Welcome to the deep dive. If you're looking to get a solid handle on a key topic without, sifting through mountains of information, you're definitely in the right place.
Absolutely.
Today, we're tackling a condition that's probably crossed your radar, especially if you're revising anything ophthalmology-related, blepharitis.
Mm-hmm.
Think of this as your rapid revision session, sort of zeroing in on what really matters.
Exactly. We've taken a deep dive into the details so you don't have to. Our mission today, really, is to extract the essential knowledge about blepharitis.
Right.
We've got a comprehensive set of notes here covering everything from, well, what it is to what can happen if it's not managed.
Okay.
By the end of this, you should have a really clear and efficient understanding, perfect for recall.
Okay, let's jump right in then. Blepharitis, what's the core definition we need to remember?
Simply put, blepharitis is inflammation of the eyelid margins,
Okay.
often right at the base of your eyelashes. It's something that can flare up acutely,
Yeah.
but more commonly, it's chronic, tends to recur.
Grumpy eyelids, kind of.
Uh-huh. Yeah, grumpy eyelids. I like that. It's a good way to think about it.
And there were two main types, right? Anterior and posterior. How do we keep those straight?
You've got it. So anterior blepharitis affects the front part of the eyelid where the eyelashes are rooted.
Right.
Think A for anterior and lashes. Makes sense.
Yeah.
And this can be broken down further. You have staphylococcal blepharitis, often linked to staph bacteria, maybe picture staph sticking to the lashes.
Okay.
Then there's seborrhoeic blepharitis. That's more associated with oily, dandruff-like flakes. Think sebum for oil.
Okay, so anterior is all about the eyelashes. Got it. What about posterior blepharitis then?
So posterior blepharitis involves the meibomian glands.
Ah, the oil gland.
Exactly. Those tiny oil glands inside your eyelids. They're
Wow.
crucial for a healthy tear film.
Right.
When these aren't working well, it's called meibomian gland dysfunction, or MGD for short.
MGD. Okay.
This is a major player in dry eye, and it's also very common in people with rosacea. So think P for posterior and maybe poor oil production or problems there.
That makes sense. So anterior dot lashes, posterior dot oil glands, MGD. But I seem to recall reading that telling them apart clinically isn't always that simple.
That's absolutely right. Often individuals can have a mix of both anterior and posterior involvement. It can make it a bit of a diagnostic puzzle sometimes.
Okay. Got it. So what kicks off this eyelid grumpiness? What are the causes, the etiology, and associated diseases?
Well, it's rarely just one single thing. Blepharitis is usually multifactorial.
Okay.
Think of it like a combination lock. Several factors can contribute. These can include bacterial or, less commonly, fungal infections.
Right.
The meibomian gland dysfunction we just mentioned is a big one. Allergies can play a role, and also skin conditions like eczema or psoriasis if they affect the eyelids.
And it sounds like blepharitis often has company, other conditions that sort of tag along.
Absolutely. Dry eyes are a very frequent companion. They often go hand in hand. You can also see various infections, bacterial, sometimes viral, even parasitic in rarer cases. Immune diseases and those skin conditions we mentioned, the dermatosis, can also be linked.
Okay.
And interestingly, even things like eyelid tumors or trauma can sometimes play a part in the background.
The notes specifically mention meibomian gland disease being connected to colonisation and internal hordeolum. Can you simplify those?
Sure. So a chalazion, think of it as a chronic, often painless little lump in the eyelid. It's basically caused by a blocked meibomian gland. The oil gets trapped.
Right, like a blockage.
Exactly. An internal hordeolum is more like a deeper, usually more painful infection within that same meibomian gland, essentially an internal sty.
Ouch.
Yeah. And while not directly blepharitis, that chronic inflammation can sometimes contribute to developing pterygia, those wing-like growths on the white part of the eye, the conjunctiva.
Fascinating how it all interconnects, and even systemic diseases are mentioned. Things like IBS, anxiety, cardiovascular issues. That seems like a really wide net.
It is intriguing, isn't it? While the exact mechanisms are still being researched, the thinking is that maybe shared inflammatory pathways or perhaps hormonal imbalances can create a sort of systemic environment that also affects the delicate balance of the eyelids and tear film.
Huh. Okay, so we know the potential causes. Who is more likely to get blepharitis? What are the risk factors we should be aware of?
Several things can increase your risk. Advanced age is one. As we get older, our glands might not function quite as efficiently.
Makes sense.
Poor eyelid hygiene is another big one. Not regularly cleaning away makeup and debris can definitely create problems.
Right.
Dry eye syndrome itself makes you more susceptible, which can create a bit of a vicious cycle.
Ah.
Skin conditions like rosacea have a really strong link. Contact lens wearers might also be at higher risk, possibly due to how lenses affect the tear film or hygiene.
Mm-hmm.
And a history of allergic reactions can also contribute.
Okay, so age, hygiene, dry eyes, rosacea, contacts, allergies.
Got it. Now, let's dive a bit deeper into the pathophysiology. What's actually happening at a sort of cellular or mechanical level?
Generally, it seems to involve a mix of issues. You get a buildup of debris along the eyelid margin, often from excess oil production from those glands.
Okay.
This environment can become a bit of a party for bacteria, leading to bacterial overgrowth.
Right.
Your immune system then steps in, but sometimes it overreacts with inflammation, and that causes the redness and the itching.
So a chain reaction.
Yeah.
And the notes mentioned the exact pathogenesis is often unclear.
That's right. Pinpointing the precise sequence of events, what starts it all, can be tricky in many cases.
Okay.
But we do have some insights into specific scenarios. For instance, in staphylococcal blepharitis, while we often suspect a high load of staph bacteria, tests don't always actually show significantly elevated levels.
Oh, interesting. What about the seborrhoeic type?
That one's closely linked to seborrheic dermatitis, the condition that causes dandruff on the scalp.
And it often occurs alongside posterior blepharitis and that meibomian gland dysfunction, MGD.
Right. And we've mentioned MGD, the blocked glands leading to dry eyes. But what about those Demodex mites? I saw them mentioned.
Yes, Demodex. They're tiny mites that actually live naturally in our hair follicles and oil glands, usually harmless.
Okay.
But an overgrowth of these mites, particularly in the eyelash follicles and meibomian glands, can sometimes contribute to the inflammation. A bit like having uninvited house guests causing trouble.
Right. Okay. So these different types, anterior and posterior, they can overlap.
Absolutely. They can definitely influence each other. It's very common for patients to have features of both. So many cases involve a combination of these factors.
Okay, that makes sense. So if someone comes in with these symptoms, what else could be going on? Let's talk differential diagnosis.
Yeah, good point. When someone presents with eyelid irritation, you have to consider other things. First off, common inflammatory conditions like allergic conjunctivitis.
Right. Usually more itchy.
Usually more itching and watering, exactly.
Yeah.
Then there are localized infections like a hordeolum stye, which is typically a painful lump,
Mm-hmm.
and a chalazion, which we mentioned, that more chronic, often painless bump from a blocked gland. Ocular rosacea, too, that can affect the eyes in people with facial rosacea and really mimic blepharitis.
Okay. And there are other maybe less common possibilities listed as well.
Yes, absolutely. We also need to keep rarer conditions in mind. Things like eyelid margin tumors, both benign and malignant, like basal cell or squamous cell carcinoma or sebaceous gland carcinoma. They can sometimes present with persistent eyelid changes.
Important not to miss those.
Definitely. Also, contact dermatitis or atopic dermatitis affecting the eyelids. Other infections like impetigo or cellulitis around the eye, even general conjunctivitis could be confused initially.
Okay.
Don't forget, issues specifically related to contact lens wear and, somewhat ironically, dry eye syndrome itself can sometimes present very similarly and be mistaken for blepharitis, even though they often coexist.
It sounds like a really careful examination is crucial then to sort through those possibilities.
Precisely. Looking closely at the eyelids, the lashes, the gland openings, the conjunctiva, the cornea, it's all key.
So how common is blepharitis, say, here in the UK? Let's touch on epidemiology.
It's very common, really common. Estimates suggest that around maybe 37% of adults in the UK will experience symptoms at some point.
Wow, 37%. That's like more than a third.
It is, yeah. It accounts for about 5% of primary care ophthalmology visits, apparently.
Okay.
But the exact prevalence, the exact number, is hard to nail down because, many people might just put up with milder symptoms and not seek medical help.
Right, underreported probably.
Probably.
Any differences in who gets it? Men versus women or different age groups?
Generally, it seems to affect men and women pretty equally. There's one exception noted. Staphylococcal blepharitis seems to be a bit more common in women for some reason.
Okay.
And the typical age of onset tends to be in the 4th and 5th decades of life. So often middle-aged and older adults are more frequently affected.
Okay, that paints a picture. Now, what might someone with blepharitis actually experience? What's the typical clinical presentation? What are the symptoms?
Well, the symptoms often include sore eyes, maybe a gritty feeling or burning.
Like sand in the eyes.
Exactly, that sandy, gritty feeling. People might find their eyelids are sticky, especially when they wake up in the morning.
Mm-hmm.
Typically, both eyes are affected, though maybe one worse than the other sometimes. They might also have those classic symptoms of dry eye alongside it.
Right.
And it's always worth asking about any history of skin conditions, like seborrhoeic dermatitis or rosacea, as they're often linked.
Okay, and what might a doctor actually see during an examination, the signs?
On examination, the key thing is the eyelid margins often look red and inflamed.
Right.
You might see crusting around the base of the eyelashes, especially in anterior blepharitis. Think little flakes or debris clinging to the lashes.
Okay.
In the seborrheic type, the lashes might appear more greasy and kind of matted or stuck together.
Mm.
With posterior blepharitis, you're looking for signs of that meibomian gland dysfunction, maybe blocked or capped gland openings along the lid margin, or poor quality secretions if you gently press on the lid.
Okay.
And, as we said, it's also important to check for any related skin conditions on the face and scalp. The exam really involves a close look at the lids, lashes, the tear film quality, the conjunctiva, and the cornea.
So it sounds like the diagnosis is mainly clinical then, based on what the patient says and what the doctor sees. That seems to be what the investigation section implies.
That's absolutely correct. Blepharitis is primarily a clinical diagnosis. It relies heavily on the patient's history and the findings from the eye examination.
But sometimes swabs or cultures might be done. When would that happen?
Yes, occasionally. If a bacterial infection is strongly suspected, maybe because it's not responding to the initial treatment like lid hygiene, or if the presentation looks unusual or particularly severe, then eyelid swabs might be taken.
Okay.
That helps identify the specific bacteria involved and guide antibiotic choice if needed.
Are there any specific blood tests or imaging tests to definitively diagnose blepharitis?
No, there's no single specific diagnostic test that confirms blepharitis itself.
Right.
However, in more severe or persistent cases, or if there are signs suggesting other eye problems might be going on, then a slit lamp examination is really helpful.
That's the microscope for the eye.
Exactly. It gives a highly magnified view of the front structures of the eye, the lids, lashes, cornea, conjunctiva, tear film, really allows for a detailed assessment.
And the notes mention repeating swabs for severe or recurrent cases. What about biopsies? When would you ever consider something like that?
A biopsy is generally reserved for situations where there's a suspicion of malignancy.
Okay, like a tumor.
Precisely. If there's an unusual-looking lesion on the eyelid margin that isn't healing, or persistent loss of eyelashes just in one specific area, or other atypical features that raise concern for something like a skin cancer on the eyelid, then a biopsy is crucial to rule that out.
Right, makes sense. Got to rule out the serious stuff. So, assuming it is blepharitis, how do you actually manage it? What's the treatment approach?
So the main goals of management are 1, alleviate the symptoms, make the patient feel more comfortable. 2, reduce the inflammation. And 3, address any underlying causes if possible.
Okay.
It usually involves a combination of approaches, and patient education is key.
Warm compresses and lid hygiene always seem to come up first. Why are they so important?
They really are the foundation, the cornerstone of managing blepharitis, especially the chronic types.
Okay.
Warm compresses, usually applied for maybe 5–10 minutes, typically twice a day, help to soften any crusts or debris on the lashes. Crucially, they also warm the oil within the meibomian glands, making it less thick and helping it flow better.
Liquefying the oil.
Exactly. Then lid hygiene follows. This involves physically removing that loosened debris and excess oil from the eyelid margins. Think of it as essential daily maintenance or spring cleaning for your eyelids.
How exactly do you do this spring cleaning? What are the steps?
It generally involves 3 key steps after the warm compress. First, gentle massage of the eyelid margins, usually towards the edge, to help express the oil from the meibomian glands.
Okay.
And then cleansing the eyelids. This is often done using a cotton bud dipped in diluted baby shampoo, a very weak solution, or, more conveniently, using commercially available pre-medicated lid wipes or solutions designed specifically for this.
Right.
The goal is to gently scrub along the lash line to remove the debris and help reduce that bacterial load and inflammation.
And what about the dry eye that often goes along with it? You mentioned that earlier.
Yes, managing the associated dry eye is really important for comfort. Artificial tears, lubricating eye drops used regularly throughout the day can provide significant relief from that gritty, dry feeling. Sometimes thicker ointments are used at night.
Okay.
And it's absolutely vital to educate patients that blepharitis is often a long-term condition. Consistency with this lid hygiene routine, even when symptoms improve, is essential for keeping it under control and preventing flare-ups.
That makes sense. The notes also mention antibiotics. When do they come into play?
Antibiotics are generally considered if there's clear evidence of a bacterial infection, like significant crusting or discharge, or if the condition persists or worsens despite good, consistent lid hygiene.
Okay.
Topical antibiotics, usually in the form of an ointment applied directly to the lid margins or sometimes drops, are typically the first line.
Right.
Systemic antibiotics, like oral tablets, such as doxycycline or other tetracyclines, might be used if topical treatments aren't sufficient, or particularly if there are associated conditions like significant ocular rosacea or severe meibomian gland dysfunction.
Are there any cautions with those?
Yes, definitely.
Yeah.
Systemic antibiotics, especially tetracyclines, need caution. They're generally avoided in children under 12, during pregnancy, and while breastfeeding. They can also make the skin more sensitive to sunlight, so sun protection advice is important.
Good to know. And I see a specific note here that corticosteroid drops are generally not recommended in primary care. Why is that?
That's an important point. While corticosteroid eye drops can be very effective at quickly reducing inflammation and symptoms, they also carry potential risks, especially with prolonged use.
Like what?
Things like increasing the pressure inside the eye, which could lead to glaucoma, increasing the risk of eye infections, and potentially causing cataracts. Because of these risks, their use is usually initiated and monitored by an ophthalmologist, not typically started in primary care.
Okay, specialist territory then. What about addressing underlying conditions, or I think you mentioned omega-3 supplements earlier?
Yes, treating any underlying skin conditions, like managing rosacea or seborrhoeic dermatitis effectively, is important as they can significantly contribute to the blepharitis.
Right.
And there is some evidence suggesting that omega-3 fatty acids, found in things like fish oils or flaxseed oil, might help improve the quality of the meibomian gland secretions and reduce overall inflammation. So they could be a helpful complementary addition to the management plan for some people.
Interesting. And finally, for management, when should someone with blepharitis actually be referred on to a specialist, like an ophthalmologist?
Referral is definitely recommended in certain situations.
Mhm.
If there are signs of a more serious infection spreading, like orbital or perceptal cellulitis,
Okay.
if there's any suspicion of malignancy, like those unusual lesions or persistent lash loss we talked about,
Mhm.
if the patient experiences a decrease in their vision,
Right. Vision changes are key.
absolutely.
Mm.
If there's evidence that the cornea, the clear front window of the eye is involved, like keratitis, if the diagnosis is uncertain after initial assessment and management, or if there are other significant concurrent eye diseases that need specialist input.
Okay, that's clear. So blepharitis is often a long-term thing. What's the prognosis generally like?
That's a good summary. It often is chronic. The prognosis really varies depending on the underlying cause and how well the individual responds to and adheres to treatment. However, the good news is that effective symptom control is very achievable for most people with consistent management, particularly that diligent lid hygiene.
So we should probably expect some ups and downs, periods of remission, and then relapses or flare-ups.
Exactly. That's a very typical pattern. It's common to have periods where symptoms are minimal or well controlled, followed by exacerbations, maybe triggered by environmental factors or lapses in routine.
Oh, okay.
But it's reassuring for patients to know that if any complications do arise and are managed appropriately, blepharitis usually doesn't cause permanent damage to eyesight.
That's okay here.
Yeah, and with good patient education about the chronic nature and the importance of sticking to their lid hygiene routine, the symptomatic control can actually be very good long-term.
Okay. Finally, then, let's talk about potential complications. What can happen if blepharitis isn't managed well or becomes severe?
Yeah, despite often being seen as just annoying, it can lead to several complications, both affecting the eyelids directly and also impacting the rest of the eye.
Okay, what kind of lid problems?
On the lids themselves, you might see the formation of chalazia, those chronic blocked gland lumps we discussed, or styes, also called external hordeolum, which are acute, painful infections of the lash follicles.
Mm-hmm.
You can get eyelash problems like trichiasis, where the lashes grow inwards and rub against the eye, metarosis, which is loss of eyelashes, poliosis, which is whitening of the eyelashes,
Oh, wow.
and in severe chronic cases, you can even get scarring or ulceration of the eyelid margins, which might eventually lead to the eyelid turning inwards that's entropion or outwards ectropion.
Right, those can cause further problems.
Exactly. And what about complications affecting the eye surface itself?
Well, contact lens intolerance is a very common issue. The inflammation and poor tear film just make wearing lenses uncomfortable or impossible for some.
Yeah, I can imagine.
Dry eye syndrome can worsen significantly, especially with posterior blepharitis impacting the tear film's oily layer. The ongoing inflammation can also lead to recurrent or chronic conjunctivitis inflammation of the conjunctiva.
Oh. You might also see the formation of little bumps on the conjunctiva called cysts or concretions. And perhaps most seriously, you can develop keratitis, which is inflammation of the cornea.
The cornea. That sounds serious.
It can be. Keratitis and potentially even corneal ulceration can affect vision and requires prompt management, often involving referral to ophthalmology.
Wow, okay. So it definitely sounds like while blepharitis might seem like just a minor irritation for some, consistent management is really important to prevent these more significant issues down the line.
Absolutely. Proactive care, especially that consistent lid hygiene, really can make a huge difference in preventing complications and just generally improving quality of life for people dealing with it.
Okay, brilliant. So to quickly recap our deep dive into blepharitis, it's a common inflammation of the eyelid margins, multifactorial causes often. Remember, the anterior sort of lashes and bacteria flakes type, and the posterior MG-Doyle gland type.
Hmm.
Good eyelid hygiene, warm compresses, massage, cleansing is absolutely the cornerstone of management. It's often chronic, expect flare-ups, but effective symptom control is usually possible with consistent effort.
Right.
And it's important to be aware of those potential complications affecting both the eyelids themselves and the surface of the eye, like dry eye, chalasia, styes, and even corneal issues in some cases.
Yeah, exactly. Understanding these key aspects is really crucial for anyone looking to get a handle on this condition, whether it's for, personal knowledge or professional revision.
It definitely shows that, while common, blepharitis isn't necessarily something to just ignore, and that consistent self-care plays a really significant role in managing it.
Absolutely.
For those of you studying or maybe just wanting more resources to really nail down topics like this one, be sure to check out MSRA.com.
And freemsray.com as well. Both have a wealth of helpful materials for revision.
Great resources. And I suppose a final thought is, even though blepharitis can be a bit of a long-term companion for some people, with the right understanding and that consistent management approach, it is possible to significantly improve symptoms and reduce the risk of those potential complications. It really seems to be about being proactive and informed.
Well said. It's about empowering patients with that knowledge and routine.